The American Health Front is a presentation of Medical Media Group and the following physicians and healthcare organizations. To close our program, we'll focus on a problem that affects millions every night: chronic snoring.
I would snore terribly throughout the night and wake my wife up several times, and that's not good. When I woke up in the morning, I felt like I only slept for a few hours.
Most of us may occasionally snore, but for many people, snoring can become a more serious problem, causing sleep disturbances and obvious social problems. Snoring affects more than 60 million Americans right now and includes both men and women. What you may not realize is that dentists can play a very important role in helping you get that good night's sleep that you deserve. We went to the office of Dr. Raymond Skowronski to learn about oral appliance therapy, which can treat snoring and obstructive sleep apnea.
Snoring in most patients is caused when the tongue falls to the back of the throat and touches the soft palate. The size of the airway is decreased, and the flow of air precipitates a flutter on the soft palate, which we usually call snoring. If a patient stops breathing for 10 seconds or more, we call this an apneic event. Apnea is a contributing factor to such health concerns such as high blood pressure and/or even stroke. Myself, as a general dentist, can treat snoring and obstructive sleep apnea patients utilizing oral appliances.
Once the extent of your condition is diagnosed, treatment can be started to restore your healthful sleep.
The diagnosis sequence begins with a sleep questionnaire for the patient, followed by a complete clinical examination and air evaluation using an acoustical scan. We work closely with the patient's physician and/or sleep specialist to obtain a sleep study for a final diagnosis. We then offer various treatment options, including the use of an oral appliance for snoring and obstructive sleep apnea.
Dentists with specialized training in oral appliances, such as Dr. Skowronski, can provide the answers for you.
The treatment of snoring and obstructive sleep apnea oftentimes begins with the patient. If patients eat late at night, drink excessive alcohol, sleep on their back, and are slightly overweight, these may be contributing factors to the patient's treatment. The oral appliance therapy that I utilize basically advances the jaw and the tongue to keep the patient's airway open. The appliances I typically use in my office are the EMA, the silencer, and a tongue stabilizing device. For patients suffering from snoring and obstructive sleep apnea, this is a treatment option that most patients embrace. It not only gives them a well-rested sleep when they get up in the morning, it also gives them a much better quality of life.
After 5 days with the appliance, my snoring stopped completely and I'd wake up feeling great. And my wife would sleep through the night, and that was good.
Dr. Raymond Skowronski offering you simple dental solutions to help you get the good night's sleep that you need and deserve. Well, we have given you a lot of information today. We hope it's been interesting and will prove helpful. Again, if you missed any of the phone numbers, please call this number, 1-800-984-2010. For all of us on the program, I'm Ernie Bjorkman. Thank you so much for watching, and please join us next time for the American Health Front.